It's a beautiful day in the neighborhood, a beautiful day to ask a gay doc with Dr. Renzo Corzano of Desert Oasis Healthcare. Hey, Doc Renz, how are ya?
I'm good. How are you doing?
I'm doing fine. A lot of people are coming down with the COVID. It's a summer spike. I want to put up this map that we have that has bright colors, and it looks like the California colors. These are the wastewater numbers for COVID antigens detected across America, according to the CDC. And yeah, we got that bright dark purple. It looks like we're in a zone that has a lot of spikes in COVID.
As of July 15th of 2024, there's a lot of stuff circulating around about these like flirt variants. Okay. These are basically just like subsets of the Omicron variant that kind of, started populating around December 2021. And there's like this main subvariant of Omicron called JN1. And basically these descendants from that one variant is actually KP2, KP3, and LB1, which are the ones that are circulating the most right now. They're pretty responsible for like the most infections that are circulating at this moment. KP3 basically accounts for 37% of the new infections, and this is
Wow.
actually up from 9% in May. So in just a couple of months, it's gone from 9% to 37%. And like you mentioned, people are kind of using wastewater to check for viral activity, and this has actually surged to high levels for the first time since last winter. And there's about, cases are growing in about 42 to 45 states that are not really declining. And as mentioned earlier, KP3 is the leading strain. And these strains tend to be more transmissible, but so far there's no data showing that it's a more virulent virus.
You can catch it easier, but when you get it, it's not quite as severe.
Exactly. But that, again, is also dependent on, each person's, prior medical history and also their immunity status.
What about your patient population? How are they doing?
It's hitting everybody, regardless of age. And, the severity of the symptoms really usually depend on a person's like underlying health and immunity status, right? So that's kind of how we're triaging people, basically.
Yeah, we have a
Yeah.
lot of people with issues, whether it be HIV or diabetes
Yeah.
or, so,
Exactly, or like COPD
yep.
or things like that. So those are the ones that we kind of focus on the most. So one of the questions is, why are we seeing this surge? The answer is really like low vaccination rates and also like basically waning immunity. A vaccine was released in September 2023, but only 22% of adults have gotten that vaccine, and about 14% of children have gotten that vaccine.
I got it.
So
I got it
yeah,
because I was
so there you
going on
go.
a cruise last October and I was like, you know what? I'm going to get this because you're in
Yeah.
close quarters. And so that one should be good for this flirt virus.
It should. It definitely covers it. Talking about prevention, obviously vaccine. And if you do feel sick, obviously test and kind of isolate at home until you're feeling a little bit better.
Well, yeah, the president is getting over COVID. And, what is the treatment that you recommend for people that are coming down with it today?
Yeah, so most people, it really kind of depends on how severe the symptoms are going to be. Most people kind of don't really need to use Paxlovid if it's very like mild symptoms. But I will say that if you do need treatment, Paxlovid is the go-to, but it actually has a lot of interactions with other medications. So definitely ask your doctor, or if you go to the urgent care or whatever, always have a list of your medications that you're taking so that they can check to make sure that Paxlovid is not going to interact with these. Okay. And if that's the case, you can get the other one, which is called like Gabriel, which has less side effects, but it's also kind of been shown not to be as good for, COVID as Paxlovid is. Something else that I kind of wanted to mention. So these vaccines, they're no longer called boosters. They're actually called updated vaccines. And likely they're going to be happening every year.
Like a
So I
flu
think
shot.
exactly. So this is basically where we're headed. I get this question a lot. If I just had COVID, how long can I wait to get vaccinated? Usually about 3 months.
Wow.
Okay. Yeah. And so very quickly about the different types of vaccines, there's a messenger RNA vaccine, which are the ones that most everybody got in the very beginning. But there is another vaccine called Novavax, which is like a protein subunit vaccine, which is kind of like the one that we're used to for most of the stuff that we get vaccinated for. It's a protein subunit vaccine. I'm recommending my patients that they have gotten about 4, 5, 6 messenger RNA vaccines to kind of mix it up a little bit and actually go ask for the Novavax vaccine just to have, just a variety of different, antigens.
So you want to make sure that all of those superpowers are in you to keep the COVID out.
Exactly. Yes. And then the other question I get is, how many vaccines should I have? That's a loaded question. It's also very person specific. So we have to kind of see all the ones that they've gotten. But usually for anybody 65 and over, they're recommending an extra vaccine than anyone younger than 65. So when I get that question, I pull up how many vaccines they've gotten, and then I go to the CDC website and actually count and see how many they're missing.
Well, Dr. Renzo Corzano can be found on Instagram at gaydoc.renz, R-E-N-Z, and information on the summer spike of COVID and what we can do to avoid that, because that can really, mess up your life if you got travel plans, if you got
Yeah.
people coming to visit, or you want to get
And,
out of town.
and who wants to have a fever when it's 120 degrees outside?
Exactly.
Right?
Exactly.
That just seems like the worst.
All right,
Oh,
people can
God.
send in their questions to Dr. Renzo Corzano, our Ask a Gay Doc feature. We'd love to answer them and also respect your privacy. They're confidential questions. You can send them to lgbtqhealth@mydohc.com. We appreciate the information. You're always trying to keep us safe and healthy, and we appreciate you in the gayborhood.
Awesome. Anytime.